In my experience, the quality of care that anyone who visits the clinic can expect is top rate, first class, completely thorough. And I have an experience that clearly, if it weren't for the thoroughness and the compassion that the staff have at the clinic, I might not be sitting here today. I came in with an ear infection and left being referred to a specialist and learned that I had cancer that was very rare and aggressive. And I give the clinic all the credit for discovering that as soon as we did, because where I am today could look much differently had it not been for that visit.
The vision for the Center for Healthy Living was to provide a clinic for our employees and their families on the West Lafayette campus. We wanted to be able to provide a medical home for those that needed that and didn't have primary care in the community. For those that had primary care in the community, we wanted to be able to provide them with additional resources.
So big deep breath in.
I think the Center for Healthy Living is a great asset to have as a Purdue employee. I mean, it's one-stop shopping for getting biometric screenings done, annual physical, we have a dietitian on staff, and we really want this to be the hub of our employees' wellness and a part of their wellness journey.
Ryan.
Here at the Center for Healthy Living, we are not only here to see patients for sick visits, but we can also be a primary care clinic as well. Primary care clinic means that we can control hypertension, diabetes, those long-term chronic conditions.
It's a very unique system that's put together. Not only is it a one practitioner that will be taking care of them, but there's a lot of ancillary services that are here on site.
Then we can also rotate in some ibuprofen or Tylenol.
We are here for your overall wellness holistically, meaning that we're here for your mental health, that we have services for that. We have health coaches, registered dietitians, pharmacists on staff, as well as providers here that can oversee your wellness with your annual visits and your lab work, as well as chronic disease and health concerns.
Preventive care is important to Purdue because we want our employees and their families to take that opportunity to sit down with their primary care provider and talk about what's going on.
The advantages of the Center for Healthy Living really are, I think, a few things, right? I mean, it's quality of care, it's convenient, and it is accessible for employees and their families.
Now what I'm going to ask you to do is to open your mouth real widely.
Generally very good about getting their appointments right on time, and we have the ability to get people, if they need to be seen as an urgent situation, we have the ability to see them quickly as well.
Okay, so 3 months fasting labs.
You got it.
I think employees that come to the Center for Healthy Living should expect a quality of care that is on par or better than what you would normally receive at any type of primary care or minute clinic type of operation. And we aim to do as good or better than what you would find at any other provider out there.
The Center for Healthy Living is available to all of Purdue's benefit-eligible employees. They do not have to be on a medical plan in order to come and utilize the services, both the primary care, the lab, and all the no-cost wellness. If they do use primary care or acute services with one of the providers, they will have to pay a nominal fee. And then family members do have to be on the medical plan to use the services, both from providers, the lab, as well as the no-cost wellness.
Something that I wish more Purdue employees realized is that this clinic is a great benefit to us. It's a gold mine in our backyard. The care, the quality of care, the convenience, it's just a benefit we need to make sure people understand is at our beckoning, if you will, and that we should be taking advantage of it. It's really nice to have right here on campus.